Hi, and welcome. I'm Dr. Jarvis, and today we're going to be using the CD in the back of the book, something you probably haven't even opened. Today's topic is the nursing process, which includes assessment, diagnosis, planning, interventions, and evaluations, also known as ADPI. Let's review our scenario for the day. Mr. T is a 75-year-old Hispanic male admitted to your floor with complaints of fatigue, nausea, and slight confusion. About a week ago, he was on the phone with his daughter and complained of increasing fatigue. A few days later, his neighbor stopped by and noticed that Mr. T didn't quite know where he was and was a little bit out of it. So he decided to call the medics. When the medics arrived, Mr. T denied any complaints of pain. On a more personal note, his wife had died about 6 months earlier of unrelated incidents. A little past history on Mr. T is he has hypertension and diabetes. So let's get started. But remember, in this video, you will see normal findings. Keep in mind, in your own practice, you will see the same findings, normal variations, and abnormal findings. So have fun.
Good morning, Mr. T. All right, Mr. T. As you know, we've been running multiple tests on you today, and I wanted to share some of the findings with you, all right?
Okay.
Your temperature is 98.6 degrees. Your pulse is 75 beats per minute. Your respirations are 20 breaths per minute, and your blood pressure is 90/60. Now, I was listening to your pulse at your carotid. On the right side, it's clear, but on the left side, I heard a bruit, a 2+. All right? Your chest was clear to auscultation and percussion. Your heart sounds were normal, S1 and S2. Your abdomen, bowel sounds were present in all 4 quadrants. As you know, we did a CAT scan today, and we are still waiting for the doctor to come back with those results. And as far as your blood panel goes, it was normal, except for your white blood cell count, which was just a little bit high.
Okay.
Okay? Now, I have a few questions for you.
Yes.
Do you know where you are, Mr. T?
Santana's Grill?
Santana's Grill.
Yes.
Okay. All right. And are you aware of your name?
Yes, Mr. T.
Mr. T?
Yes.
Okay. All right. And do you know the date?
Oh, 1974.
All right.
Yes, disco.
Mr. T, do you have any further questions?
No.
Thank you very much.
Okay, to come up with a nursing diagnosis for Mr. T, we read these charts, kind of get a feel for all my assessments. You know what? Acute confusion sounds really good. You know what? I've got it. Acute confusion. I am nursing diagnosing Mr. T with acute confusion. So, next step. Short-term goal. Mr. T will be reoriented to the place by the end of the shift. That's a good one. Write that one down. Okay, so short-term goal interventions. Number 1. Regular and systematic reassessment of patient's mental status by asking Mr. T to recite his name, current location, and the date. Period. Good job, go me. Okay, next one. Number 2. Assess Mr. T's behavior and cognition methodically and frequently throughout the day and night as appropriate. Number 3. Maintain a quiet and non-stimulating environment. That sounds relaxing. Okay, so for some long-term goals. Let's see. Oh, I got it. Mr. T will demonstrate reestablishment of cognitive status to baseline oriented times 3 at discharge. So some long-term goal interventions. Number 1, provide reality orientation, including identifying self by name, Bethany, that's right, at each contact with Mr. T, using orientation techniques, providing familiar items from his home, displaying a clock, a calendar, and gently correcting misperceptions. Ooh. Okay. Number 2, treat the case of the acute confusion per physician's order. And number 3, teach and counsel Mr. T and his family regarding management of delirium and how to recognize signs and symptoms of early confusion and to contact medical help. You know what? I'm good to go. Let's go see my patients.
Hi, Mr. T's daughter.
Hi.
How are you doing today?
Good.
Good. My name's Erica. I'm one of the nurses that's going to be helping take care of your dad while he's here in the hospital with us.
Oh, nice to meet you, Erica.
Good. It's nice to meet you too. Well, one of the reasons I wanted to talk to you today was because we wanted to teach you a couple techniques that you could use to help reorient your dad and reduce his confusion while he's here in the hospital.
Oh, that's so good, Erica. I'm so worried about my dad. I don't know, how he's gonna go back to his normal.
I know you're really worried about him, and his ultimate goal of returning back to his baseline and not being confused anymore, being alert and oriented times 3, well, we can achieve that by maybe you implementing some of these techniques that I teach you today.
Oh, how you guys gonna do that?
Well, one idea would be this. If you wanted to maybe bring in some familiar items from home, like some pictures or something like that.
Oh, that's a good idea.
Yeah. One of the reasons that would be really important is because it provides reassurance and aids in reducing anxiety, and anxiety can trigger agitation and confusion, which, as you know, we don't want.
Yeah, that's so true.
So another idea we have is we'd really like you to participate in your dad's care as much as possible by being at the bedside whenever you can.
Oh yeah, I can definitely do that for my dad.
That's good. One of the reasons that's so important is because having a familiar person in the care setting can help reorient the patient. So we want your dad to be familiar with the people that are around him, and that'll remind him of home.
Okay.
So do you think you got those techniques down?
Yes, I think I can remember that. So I should bring some familiar, stuff from home, like pictures.
Mm-hmm.
And I can, definitely be there, with my dad all the time, by his side.
Perfect. I think if you do that, your dad will definitely be able to achieve his long-term goal of returning back to his baseline.
Good. Thank you so much, Erica.
You're welcome.
Oh, hi. Hi, Erica.
Hi.
How'd it go with Mr. T's daughter?
Oh, actually, it went really great. Yeah.
Really?
Yeah, I showed her all the techniques that we talked about, and I really felt like she got a good handle of the different techniques that we showed her to help reorient her dad and reduce the confusion.
That's great, but how are you going to evaluate that you got the point across?
Actually, it's really funny you mentioned that. I was just thinking about how I was going to evaluate that, but I really think the best way to do it would just be through direct observation. Observing whether or not she brings in any objects, or, seeing how often she's at the bedside and participating in his care. I really think that's the best way to do it.
Sounds like a great plan.
Yeah. Anyway, I was thinking maybe we should go over and check on him right now. What do you think?
Great idea. Let's go.
Okay, let's go.
That's your favorite dog. Do you remember him? His name is Peanut.
Oh my god! Peanut! I miss Peanut.
Yeah, he died like 2 years ago. And that's Mom right there on her swimsuit.
Oh, she's a hot one.
Yeah.
She's hot.
Yeah. And that's my brother.
review what we've learned today. The nursing process is a huge factor in nursing care. And due to that great nursing care, Mr. T was able to return home and live an absolutely wonderful life. Thank you. Enjoy.